It's so wonderful to be with all of you this evening, evening your time. And I just wish it could be in person. Although the upside is then I get to go from here to my grandson's baseball game. So that's always kind of a nice thing. Um, so I've been in the public health field for, I don't know, 45 years. And one of the things that drew me to the field is that it's a delicious mix of science and planning and advocacy all wound up together. And that's a interesting nest of approaches to improving the well-being of people everywhere. So this is going to be a talk about war, and I'd like to start by defining it. Maybe a good place to begin is to talk about what it's not. And, people sometimes think that war is a natural byproduct of human nature because humans are prone to aggression and conflict and disagreement. And I would say, even if you believe that that's a basic foundation of human nature, that we're prone to disagreement, that is not war per se. War is organized by people with power who are pursuing their interests. And this is tremendous power to assemble weapons, conscript troops, and frighten people. So war isn't just the sort of underlying conflictual nature of human beings. And a thing to note for us Americans in the crowd is that the United States hasn't won a war since 1945. We lost the war in Vietnam, Korea, Iraq, and Afghanistan. And we were on the wrong side of the wars in Central America in the 1970s and 80s. And now we're paying the price for that with refugees at our southern border fleeing the chaos that we wrought there. And so why do we keep fighting wars that we don't win? Doesn't that seem irrational? And who does it serve? That's a thing to think about. And maybe this is part of the answer. Powerful companies and their owners and executives, largely people who do not send their own children into war zones, they're raking it in. War serves them. War isn't interpersonal aggression. It's not about anger or other human emotions. It's about power and wealth being displayed and exercised on the world stage. And we go along with it for a variety of often nefarious reasons. So public health, I think, has a role in understanding how war affects health and intervening. So public health does have a little track record of going after power and wealth, and it's a track record I'm proud of in our profession. We've done some remarkable things over many generations, some of which required standing up to powerful people and their interests. I read up a little on Roger Williams, after whom your university is named, and I see he was the sort of person who stood up to power and wealth and cared about freedom and equality also. So that's something to be proud of for you folks. So public health has gone after the tobacco industry. We've insisted that cars be safer. We've worked on gun violence. We've championed anti-racism policies. We've gone after food industries, and we've stood up for reproductive health rights. All of that required some bravery, I would argue. And I'll just say poor health is mostly produced by unintentional side effects of pursuing the things we like and that we want. We like Cheetos and red meat. We like warm homes and fast cars, and those things generate waste, which has to go somewhere. We like to doom scroll and drink whiskey, which is bad for our mental health and our well-being. The funny thing about war, though, is that it's a side effect of something that isn't itself useful. It's the side effect of the maldistribution of power and wealth and weak international institutions. It's not an unfortunate side effect of something we like to do. It's just a bad thing. And I'm afraid we haven't yet imagined a world without it, and it's time to do that. I wrote this essay about 7 years ago for a journal called Medicine, Conflict, and Survival, discussing the struggle to get war on the public health agenda. That would require allocating research funds for the health consequences of war, about which there are very few research requests for proposals. It would require space in journals and some dedicated journals, time at conferences, and courses taught in our schools of public health. I'm convinced public health approaches at primary, secondary, and tertiary prevention levels can all be helpful to this project. So the World Bank estimates that about 2 billion people, a quarter of the world's population, are now living in harm's way in areas affected by conflict. And the 20th century saw 200 million conflict-related deaths. Civilians are increasingly the targets of these deaths, including in current wars. And there's a lot of wars going on right now, including ones that don't make it into the news very often. Of course, Gaza and Ukraine are in our papers every day, but there's also Myanmar and Nagorno-Karabakh in Armenia, Mali, Central African Republic, Sudan, the Somali Civil War, Syria, and the Sahel in North Africa. And yet, for most health professionals, war is just wallpaper, the stuff going on in the background while we're busy here taking care of serious problems like the opioid epidemic, gun violence, rising suicide rates, the health effects of homelessness, and the constraints of austerity spending. And while we're busy here, all the war stuff is going on in the background, and we fail to connect the dots from what's happening back there to what's happening in front of us. So let's talk a bit about that. First, I will say the American Public Health Association, of which I am an avid and fond member, adopted this resolution in 2009, proclaiming that public health practitioners have an important role in advocating and researching and teaching about war and health in our classrooms and institutions and the various places in our profession where we present work. And I'll note that the World Health Organization has noticed that conflict here has direct and indirect effects on health. And it has this very nice conceptual framework around how these various components work together to produce very poor health effects. I'm a big fan of conceptual frameworks, so I like this portrayal. So I'm going to talk in the rest of our time together, in terms of those dimensions, direct and indirect effects of war. So to start, I'll share with you just a little data from the study that Mary Beth mentioned that I led to measure mortality in Iraq from the 2003 George Bush administration invasion of that country, a war that unfortunately was supported by a lot of politicians on both sides of our sort of silly party aisle. So direct effects, soldier deaths are relatively easy to count since military organizations keep track of that sort of thing. And since the United States gave up the draft after our war in Vietnam, our soldiers are now volunteers. And I'm going to talk more about military recruitment later in our talk today. I just want to note here that soldiers dying are those who are disproportionately young. Look at this. So 21-year-olds were the biggest group of soldiers who died in Iraq. And they're also disproportionately poor, of course, as policymakers and captains of industry aren't sending their children into harm's way. Our study was conducted through a collaboration among 4 universities. And we conducted it in 2011 as President Obama was withdrawing US troops. And we had a wonderful team of people working on this. In this photo is Riyad Lafta from Mustansiriya University Medical School in Baghdad, and Gilbert Burnham from Johns Hopkins. And this was Lindsay Galway, who designed our innovative sample selection process. process for this study that many have adopted since she designed it. So Lindsay's sampling method involved selecting 100 neighborhoods or clusters of 20 households across the country using a randomized population proportionate to size method. So, you know, Iraq is a country with a lot of desertified areas, and you wouldn't want to try to doors in the desert where there are no homes. So here we practiced finding clusters and their start households in this photo when we visited Erbil at the beginning of the project in March of 2011. Dr. Lofta's medical students and graduates knocked on 2,000 household doors for this study. And just here's a figure from our study showing specific causes of death among household members, both in the period immediately before the war and throughout the conflict. Here are the years of the war all the way at the bottom. The dark red portions of the bars represent deaths directly caused by war-related conflict. So these are people who died under explosions or in gunfire, whereas the lighter colored portions of the bars were from indirect causes. And in the end, we estimated roughly 500,000 deaths in Iraq could be attributed to the war period 2003 through 2011. And here is our paper if you want to go find it in PLOS Medicine. It's an open access paper. So those were direct causes. There are also other direct harms that aren't quite so intended as killing people directly through bombs and weaponry. And one thing we must acknowledge in this country is that the United States has 23 million military veterans, and studies of their health indicate they fare poorer in overall health and in many specific problem areas related to health. They have more limited activities, they smoke more, they drink more, they have more heart disease, more cancer, and more depression. And we know they are disproportionately more likely to be homeless as well. And here's another thing that affects people in the military. Jessica Turchik has researched sexual assault within the military, finding 1/3 of women in the military report military sexual trauma. Those at risk, of course, are younger, less educated, non-white, single, and in lower pay grades, and they rarely get justice for the attacks that they endure. I also want to talk about the military's role in climate change. Militaries across the globe are huge consumers of fossil fuels. The U.S. Department of Defense is the single largest institutional fossil fuel user in the world. Since 2001, the military has been responsible for up to 80% of federal energy consumption. Military bases are associated with poisoned wells, noise pollution, leaking chemicals, and unexploded ordnances. Chemical weapons are now banned, thankfully, and the US has destroyed most of our stockpiles, but sometimes this stuff turns up in the darndest places. People apparently forgot about a World War I chemical weapon dump in northwestern Washington, D.C., and they built fancy, expensive homes in this part of the city. Good thing it was a wealthy neighborhood because there was some motivation to clean it up. And I say that only sort of tongue-in-cheek, as we know communities with less wealth and power are less likely to achieve any environmental justice. And here's another fun thing. Militaries have dumped tons of horrible things in our oceans, and we're certainly reaping the rewards of that these days. The military is guilty of a lot of environmental racism, where it builds its waste disposal dumps, what it tolerates on its military bases, where it locates its bases. There's a lot to say on that topic. The US military also conducts open pit burning of all sorts of things from tires to chemicals in its theaters of war. Joe Biden implicates these exposures in his own son's death after serving in Iraq, one of the very few children of important people who did military service. So let's talk a minute about indirect harms. So The most obvious indirect harm is the distribution of resources aimed to the military and its wars that could be going towards health, education, social services, children, all sorts of much more productive things. And of course, the US spends more than a collection of other countries put together. The defense budget request for this year is now at $850 billion. And I just drew this little chart to show how it compares to the WHO budget, which is $4 billion. It's just remarkable what the difference is. And Holly Priggerson and her colleagues wrote this paper using 1990s data, so it's an old paper, but they found that 1 in 5 cases of partner abuse in the whole United States could be attributed to exposure to combat, which I just thought was a remarkable finding. And that was before the 2000 invasion of Afghanistan or the 2003 invasion of Iraq. And I called her up once and said, why don't we repeat that study? And she said, yeah, they don't collect that data anymore. Pity. So here's another indirect cause of death that I think is worth tracking. This remarkable researcher, Diego Gutierrez, has studied bereavement as an indirect harm of war deaths. He's developed a method for measuring the number of family members left behind after war deaths, which he applied to the Rio Negro population in Guatemala. So 1/3 of the population was killed in that early 1980s genocide, but 2/3 of the population was left bereaved. And I think it's an interesting sort of quantification of a health effect of war. Suicide among veterans was the fourth leading cause of years of potential life lost in this 2019 study. The youngest veterans are at greatest risk, as you can see by this red line in the bottom chart. It's just sad. And this report is remarkable for the size of the study population, more than 16 million person years in the military's own defense medical surveillance system. The leading category of hospital discharge diagnoses among service members was a mental disorder. Think about that. War is driving us all crazy in so many ways. This study came from an analysis of the Millennium Cohort, a defense manpower data set, which found a linear relationship between age and the proportion of the cohort with problems associated with PTSD, depression, panic disorder, anxiety, and alcohol and eating disorders. Again, the youngest service members were the most harmed. This was a study of 500,000 Afghanistan and Iraq veterans who visited a VA facility after leaving the military, finding high rates of substance use disorder, especially among the youngest veterans. And this research was conducted by my friend Kim Koronek, who's at the University of Utah, who has studied the long-term health effects of exposure to combat by working with people living in North Vietnam and measuring the extent of their exposure to combat and then the long-term chronic health effects, including heart disease and things you wouldn't necessarily think could be associated with exposure to combat. It's also associated with cognitive decline in this new paper that came out recently. So militarism affects our societal norms, which is another way in which we achieve indirect health effects across our country. I'll say police violence is not incidental to our permanent war way of being. We all noticed the remarkable national response to the assault on George Floyd in Minneapolis at the start of the 2020 COVID epidemic. Many people and institutions responded to that incident with a new commitment to ridding our society of the worst effects of racism. However, this would require an acknowledgement of the strong effect of the military on our national values. A survey of 8,000 police officers found a large proportion reported current or prior military service. It's one of the few jobs for which military service prepares you. Militarism has entered our high schools as a product of national legislation that requires schools to open their doors to military recruiters. Public schools must allow military recruiters into their buildings, and they also must turn over the names and contact information of their students to military recruiters by federal law, unless the parents proactively opt out, which interestingly has provided an opportunity for people to do organizing campaigns in the high schools, as we did back in the day, to get parents to proactively opt out. And when the US invaded Iraq, I had a kid at Garfield High School in Seattle, and I was active in the PTA. And we passed a resolution opposing the war in the fall of 2002. And then later we passed a resolution opposing the increasingly aggressive military recruitment in our schools' hallways, lunchrooms, and counseling offices. And just passing this resolution was an amazing thing that drew press attention from around the world, from Japan and German newspapers and TV stations. And maybe it was the absence of much of an anti-war movement nationally, and so the press was hunting around for stuff, but we got a lot of attention for this. This was the front page of our local Seattle newspaper that day. That's me confronting a recruiter in our school lunchroom. So even though it hasn't been studied directly, we do find evidence, as I've already shown you today, that the youngest soldiers and veterans have the poorest health outcomes, which is shocking given younger people should have the best health outcomes, suggesting early recruitment is a threat to health. And young people are easy targets for recruitment because they're not good at calculating risk. Curiously, adolescents are more adverse to clearly stated risks than their older peers. However, they're more willing to accept more uncertainty about that risk. And as you might imagine, military recruiters are not very forthcoming about the risks associated with signing up with their service organization, Navy, Army, Marines, and so on. They're not going to tell kids about their risk of being sent to war or their risk of being hurt or killed, and or getting addicted to alcohol and drugs, all the things that I just showed you about. Matter of fact, when they would come to Garfield, they would talk about how great the military band is. And, you know, we had a music-oriented high school, so why don't you join the military and you can join the band, as if that were really an option for very many kids. This was what military recruiting looked like in our library. They'd set up a table here and get kids to drop and do 10 or whatever that was. And so, it'd be good if we did some research on the effects of early recruitment into the military. We, of course, have no National Institutes of Health funding for research like that. I will note that in the news last week was notice that Ukraine had lowered its age of military recruitment to 25. It had been 27. And of course, we're recruiting teenagers into our military. We don't wait till 24 or 27. And the US has never ratified its participation in the 1990 UN Convention on the Rights of the Child. And one reason for that, of course, is that we recruit underage children in high schools into the military. Look at the age of this child. It's because we have junior ROTC in our schools, which sometimes substitutes for gym class because the schools can't afford to fully cover all their courses. And the military knows what the tobacco companies knew. If you don't get them hooked early, they're not going to join you. So, and if anybody wants some interesting reading, this is the Recruiter Handbook, which you can find online, and it describes all the very nefarious ways in which military recruiters can worm their ways into high schools and into contact with students. We wrote this paper for the American Journal of Public Health back in 2010. presenting some of the evidence at the time around military recruiting and health. And one of the things we pointed to was the ways in which military recruiters engage in what we called predatory grooming, the process by which a child is befriended by a would-be abuser in an attempt to gain their confidence and trust, enabling them to get the child to acquiesce to abusive activity. And sort of interestingly, when our paper came out with that comparison to predatory grooming, the person who called me out on national television for authoring such a paper was Bill O'Reilly. So the older people in the audience will recall who Bill O'Reilly is. He was a commentator on Fox News who sort of amazingly subsequently lost his job for being a sexual abuser in his own workplace. So I guess he knew a thing or two about predatory grooming. So what should we do about all this? We're in the field of public health, and we have not a lot of tools, but some tools. And what are some approaches we could do, we could bring to this that would put war on the public health agenda and could start shifting our nation's approach to this problem? Well, one of the things we did back in the beginning of the invasion of Iraq was published, carried it around at marches. It's a way of calling attention to things and building support among people in our group. We also formed a sister university relationship with the University of Basra in southern Iraq. And this created a really nice opportunity to do something uniquely public health oriented. We befriended a pediatric oncologist in Basra, Dr. Janan Hassan. We brought her to Seattle. And then we helped her study her leukemia data and published a paper on that was produced in the American Journal of Public Health. We brought speakers to campus, and we continue to bring speakers to campus on this topic. There are many very qualified, interesting people who come who are researchers or journalists or people in this field. And we taught this class on war and health for about 9 years at the university, and it'll be picked up again next year by a colleague since I've retired now. I love this t-shirt worn by one of my favorite students over the years. The pen is mightier than the sword. I just love that t-shirt. Another thing we can do is publicly protect whistleblowers. When wars are launched by those who stand to profit from them, we most definitely need investigative journalists to tell us what these people are up to. We owe them for the risks they take to inform the public, and we should defend them when they need it. Julian Assange has now been in Belmarsh prison in London for 5 years. I think the anniversary was this week. And it's time for the United States to drop its charges against him for releasing secrets that revealed war crimes the United States conducted in Iraq. Another one of my favorite whistleblowers is John Kiriakou, who is a CIA analyst. And he was approached, apparently, as he came to our campus and talked after he got out of prison. And he described being approached in the CIA lunchroom about joining the CIA torture team. And he said, "You can't do that, that's illegal." And he went to his bosses and reported, "Do you know they're organizing a torture team, which is illegal?" And his bosses didn't care, so he released the information to the media. And for his trouble, he became the first CIA officer to be convicted of passing classified information to a reporter. He pled guilty because he did it. He was sentenced to 30 months in prison and lost his pension, although nobody who actually conducted the CIA torture program ever faced consequences, went to jail. There's a funny side story on this where he approached the Trump administration at the end of his term in 2020, asking for a pardon. And apparently Rudy Giuliani offered him a pardon in exchange for $2 million. And Kyriakou laughed and he said, why would I spend $2 million to get a $700,000 pension back and you can't give me my 30 months in prison back? So, you know, corruption just goes on and on. It's important to also notice how your consent is being manufactured for the wars that we get ourselves into. Mass media serves as a system for communicating messages and symbols to build our consent for war. This was a book written by Noam Chomsky explaining how this whole system works. And you can make a personal commitment to stay well informed about all the things going on that are war related. I'll say I listened to the NPR radio show called On the Media recently, which talked about the news sources that Israelis get about what's happening in Gaza. And these are very constricted, very carefully curated news sources. They don't really know what's happening. And of course, that way their consent can be manufactured because they don't know. We also need strong, inclusive, justice-oriented global institutions. World peace will require those things to settle conflicts and promote justice. And the way we organize our Security Council at the UN definitely needs reform, as it's dominated by the nuclear-powered states and often undermines international consensus. The International Sustainable Development Goals list does have peace on the list as an international goal by and by, but it's almost the very last item on the list, curiously. And maybe we ought to bump it up a little, huh? Humans have a long history of creating international legal agreements on the use of force. The St. Petersburg Declaration of 1868 banned certain kinds of bullets, for example. The 1899 Hague Declaration rejected the use of projectiles for delivering poisonous gas. The 1972 Biological Weapons Treaty appealed to the conscience of mankind for stopping the use of biological weapons. In 1993, the world banned chemical weapons. The US even went along with that one. The Landmine Treaty was adopted in 1997, although the US has never signed it. The Cluster Munitions Treaty was in 2008. And most recently, the 2017 Treaty on the Prohibition of Nuclear Weapons entered into international law in January of 2021 when 93 nations endorsed it. Guess which countries did not? Nuclear weapon states. So the US is planning to spend more than $1 trillion. $1 trillion. That's just an unbelievable amount of money over the next 30 years, rebuilding our entire nuclear weapons arsenal, because apparently they're a little out of date. We'd hate to have old-fashioned nuclear weapons. Advocacy organizations are trying to derail that project. Every dollar spent on our nuclear arsenal is a dollar stripped from critical social programs, including housing, food assistance, healthcare, and education. This is an organization that formed a few years ago, the Global Alliance on War, Conflict, and Health, which has over 100 members now, 100 member organizations. Half of them are universities. You could join. And Physicians for Human Rights now has a website portraying ways in which police violence has played out around the country. Amnesty International also has featured some of the stories and evidence of police violence, and the ACLU has filed lawsuits here and elsewhere, drawing the connections between military violence and militarism in the United States and police violence is something we can all work to do. And our university University of Washington School of Public Health worked with our local ACLU chapter to catalog the weapons used and injuries inflicted on protesters by police during the Black Lives Matter protests of 2020. So we collected those and we put them up on a website. And when we unveiled the website, we held a webinar that our dean curated, and we created we called attention to the ACLU lawsuit that was filed against the Seattle Police Department. That suit was eventually settled, requiring the city to pay out $10 million in damages. Sadly, our city just this week signed another police contract that's done nothing to increase accountability for abuse of civil liberties, but does bring the starting pay of a police officer to over $100,000, which is sort of startling given that the requirements to be a police officer in our city are you have to be 21 and a half years old and have a GED. So you compare that to what a teacher is required to have and do, and that they get paid half as much, if that much. It's just another indication of our society's wrong-headedness. So we can also bring scholarship to the study of police violence and weaponry. Here, the University of Minnesota got involved with Planned Parenthood and various researchers to study the health effects of tear gas on reproductive health, which are apparently very problematic. There's also the role of art, which can't be dismissed. The arts are a good way to bring attention to war and its health effects. This artist, Banksy, specializes in portraying the health harms of the Israeli occupation of Palestinian territory. And he or she is a guerrilla street artist who remains anonymous. And I can't leave this talk without specifically talking about the situation in Gaza, described as one of the fiercest attacks on a civilian population in recent history. This is a photo of Khan Yunis, the city in southern Gaza, where Israeli forces directed people to go from the north to escape the bombardment there. And so people in Gaza are dying of bombing, sniper fire, starvation now. There's now an official famine, and diseases, much of which, of course, are attributable to the bombing, but some of which are attributable to Israel's blockade on aid getting in and the United States' decision to stop funding the UN Relief and Works Agency, which has been for decades supporting Palestinian refugees around the world. And I'll just point to a little study by University of Pennsylvania professor Ian Lustig, who has examined all the previous Israeli assaults on Gaza and determined that the only time they stop, and there have been many over the last 15 years, is it's when the United States says to stop, which I think points the finger at every one of us to get our own Congress people and senators on board with supporting an immediate ceasefire. That's sort of your homework from today's lesson. And so the aim of my talk was to encourage the public health profession to work harder to connect the dots between the health problems we see in daily life in the US and war and militarism. We're a country suffering a progressive increase in deaths of despair attributable to suicide, drug overdose, and alcohol-related liver disease in the US over the last 2 years. And by 2014, the increasing number of deaths of despair had resulted in an actual drop in overall life expectancy in our country, an international shame. Our public health profession has paid insufficient attention to the social, economic, and political determinants of health, especially war. Just a fun meme I saw on my social media feed. How about we play into a crazy conspiracy theory where we all love, respect, and tolerate each other, and life gets immeasurably better for all of us? And that's what I have for you today. Thank you. That's my dog.